This is Dr. Kevin Christie, your Boca Raton chiropractor. Today we're going to discuss the ankle and the foot joints and the different things we're looking for as far as movement within those structures. This is important on any type of foot and ankle function, whether it pertains to an injury of the lower leg or even all the way up. And so a lot of times we're checking the different motions within these joints. First thing we check for is dorsal flexion, which is just bringing that foot that way. Okay, we're going to test that with the leg straight, which is going to test certain muscles at the back of the lower leg that we're trying to rule in or rule out. But then we're also going to check it with the knee bent. That's going to take out the gastroc part of the muscle, which is the ball of the calf. And then we're going to check the ankle dorsiflexion there. I'm also going to check for kind of a soft end feel, because sometimes your calves can be really tight and cause a decrease in that motion. Sometimes it's a harder end feel where it's not the muscle or the calves, it's more of the joint, the ankle joint itself. So we're checking that dorsiflexion there. Next, I'm going to check to see if there's any excessive laxity in the joint, where there's too much motion. We want a nice blend of range of motion, but not too much. A lot of people with prior ankle sprains and injuries, we see problems. So we're going to check for the motion of the ankle in certain different types of motions of distraction and kind of front to back motion, side to side. See how those ankle ligaments are holding up. She's doing fairly well with that. So we're going to check the ankle joint. We're going to move down. I like to see how the joint between the metatarsal here and the big toe is, how that's moving. That's important in foot function. So I'm going to check that motion as well, get a little bit of joint play there. I'm going to also check outside here to see how the cuboid is moving, okay? And I know that some of these bones have all these different types of weird names, so we're not going to worry too much about that, but we're checking to see how that's moving. And then also it's important for the navicular bone in here to see how that's moving, so we're going to check that. Lastly, I'm going to look at how the big toe is extending, all right? This is very important to see how that is extending, because that's going to really help with foot function. A lot of people will have a rigid toe, the joint right here, and it doesn't allow for proper foot biomechanics, and we need to know that when we are assessing the joints of the foot and ankle. There's other joints that are working its way from the ankle down. We're not going to necessarily assess all of them at every time, but for the purpose of getting a nice comprehensive evaluation of your foot, those are some key ones to check to make sure they're moving well. If they're not, we can do some chiropractic manipulation of these joints. You know, for instance, an ankle one here, we can go and just get a nice little distraction to get some mobility in there. So it's important to get your foot function checked. Really causes a lot of different issues like plantar fasciitis, Achilles tendonitis, knee issues. We have a lot of people with metatarsalgia, which is pain at the ball of the foot, and certain conditions like that.